the first free paper 454. Dr. Suraj Singh Sengam, are you here? Yes, he will be speaking on blinding ROP, the need for rehabilitation training packages.
Yeah, thank you. Thank you, ma'am. So, thank you for this opportunity. So, my topic is blinding ROP, the needs for rehabilitation training package. So, I will start with my financial disclosures. So, I don't have any financial disclosures to show, and no conflict of interest as well.
Is your mic working?
Sorry. So, let's have a quick look. This child had never seen how people walk. So this child just, you can focus how his legs moves. So he has never seen human beings walk. So this is the clinic I have started in 2018, Dr. Rajendra Prasad Center for Ophthalmic Sciences, New Delhi. So in 2018, so we have registered blinding ROP, nearly about 336 babies blinding ROP. So as you know that blinding ROP, so there's a lot of negative impact in terms of learning and development and cognitive skills development. So for that, so we know that the sight is being lost. Then what else that we can use to improve the child's learning skills and developmental as well as the cognitive skills. So we must remember the other body senses that we have sound, touch, smells as well. Then the last option is the habilitation services. Then what is a habilitation then? The habilitation is a child is learning how to do something for the first time. See, a child has to learn it, how to walk, so which has never done before. So that is the habilitation. So as you know that the evidence are quite available nowadays that early habilitation in a child with the blinding ROP, so there are lots of improvement in terms of learning, developmental, motor skills, and as well your cognitive skill as well. And the aim of this study is development of habilitation service package for children with blinding ROP, that is stage 4 and 5. So we use the three different techniques. The first is the extensive literature search. The second is observation in my clinic. So we interact with the patient and the caregiver. The third is open-ended question. So literature search, we do a couple of literature search. We want to know what options are available for this child's ROP to develop, enhance their skills and their cognitive skills and other learning. And this is the interactions is very important, so we must focus is how we interact with the patients so that we can improve those skills among the children, ROP blind. So this is open-ended question, we use it. So we purposely selected parents and caregivers, and then we ask the questions. So suppose a child is able to identify the objects. Okay, this is a spoon, this is a glass, and then the child is able to work comfortably in our clinics, then we choose those patients for the interview. So coming to results, remember most of these skills we learn from the parents. We learn from the patient itself. So when we observe it and then we learn, we interact with the patients. So the first we categorize into essential life skills and instrumental life skills. So you will not find these topics in other literature. So in the essential life skills, there may be a couple of, but we focus in this presentation. There's a mobility, social smile, and communications training in ROP, blinding ROP child. And the instrumental life skill is object identifications, because they have never seen what are the objects available to their surrounding. So just quick focus in this. So we ask the parents, so please show us how to make your child laugh. We don't know, because we are clinician. We don't know how you make child laugh. So this mother, initially he tried, okay, with the nose-to-nose contact. We learn from the parents, nose-to-nose contact, and then he, tickle among to her baby's face. And then different technique we use it. We observe it very carefully. So I will do a little bit forward. So see the tickling in the face. And then finally, the child will start laughing when the mother tickle on her cheek. So we learn these techniques while we observe carefully in our clinic. So this is the technique, communication learning. So the first one is the fathers try to communicate with his blinding ROP child. So this is the wrong way. The second one is very interesting. The mother was sitting at the outside, at the settee, and then when you ask them, you try to communicate with your child. And then mother immediately came down and sit on the floor. See the level of at a similar level. So you'll see the video here. It's very interesting. So this is a mobility training. We also learn from the parents. So this is two-parent techniques. So these parents try to teach that how to walk. And this is the one child with the musical toys in the clinic. So this is very interesting. This also we learn from the parents. So the child is used some kind of tripod to start with the independent mobility.
Try to finish, doctor.
Yeah.
Time's up.
Yeah. Last few slides. So this is the mobility training. start with the how to provide the cane training, and this is the cane. So last slide, so, we started cane training after we know that there are, this is object permanent means the finger to finger we use, we learn from the parents. So to conclude is, we develop some kind of techniques for the mobility. We use the two-parent technique, one-parent techniques with the toys, without toys, and object permanence. We use the finger-to-finger over techniques for the blinding ROP side. And this is the age-appropriate rehabilitation service from birth to 3 years, preschool age, and school age children. And last slide. So observation is very important in the clinics, so that the rest of the child we can teach them. The most critical period for rehabilitation service is 2 to 3 years. Thank you, sir. Thank you.
I have only one question.
Yes, sure.
There are so many other conditions where babies
Yes,
are blind
very
since
true.
birth.
Very true.
Why do you select only ROP babies?
Very true. So, so recently we have started this ROP clinic in RP center. No, rehabilitation services. So in a week, around 3 days in a week. So this ROP clinic, they refer to blinding ROP. And we know that there are lots of issues, that there may be some neurodevelopmental disorder. But while we developed this rehabilitation package, we purposely selected the caregivers that the child is able to work comfortably in our clinic, and we with the orientation with the sound technique. Then we interview those parents, and at the same time we record a video, and then we started documenting those techniques. Okay, these techniques is what we should use if the child comes in the future. That is our things. Observation is so important.
Okay, thank you.